Hiya folks, welcome to the Canna Machine podcast, and I'm your host, Gary Cannaday. This is a show about the CBD and canna industry, where I talk to brands, retailers, activists and educators. My guests cover topics like UK law and compliance, product launches and campaigns, which are looking to bring about change in legislation. So, if you're a CBDer, canna curious, or blazing your own trail, hopefully there's going to be something useful for you here. Welcome to episode 4 of the Canna Machine podcast. In this episode, we look at compliance for the CBD industry in the UK. I talk to Guy Coxall, Compliance Director of the Cannabis TRades Association, and Mike Harlington, Chair of the CTA. In the final section, I sit down with David from Adact Medical to talk about product testing. First up, it's Guy Coxall. When it comes to the common pitfalls new CBD brands face, there's not much Guy hasn't seen or heard. We talk about CBD, compliance, and what future legislation may bring.
So my job is compliance director, so I make sure that products are what they say they are, that they're safe, that they're well manufactured.
What are the common issues that people face or you see coming to you in this industry?
Well, in the UK, CBD products are classed as food supplements, and there's a lot of companies selling isolates in food products, and that's actually illegal in the European Union under novel foods, so that's quite an issue. Also, companies making medical claims, pet products aren't actually allowed in the UK, so it's been a bit of a roller coaster the last few years. We're having different government departments, the EU that we work with.
I can see why it's difficult for some people who are new to the industry. They're coming in and they're talking to suppliers from all over the world. And some of those suppliers will be creating products using isolate in food, for example, which may be legal in one country, but obviously in the UK it's not.
Absolutely, and I'm happy to help anyone with compliance. It's so important that the industry all comes together and works with the government rather than against it, because otherwise we won't have an industry here.
A new business was listening right now. They're about to start launching a CBD product. What should they be checking off their list?
Medical claims is by far the biggest thing. We all get excited about CBD. We all know the properties of it. We know it has medicinal properties, but you just can't say it if it's a food supplement, because otherwise you need a medicines license, which can cost millions of pounds, and you can get in a lot of trouble. So that's one of the main key things. The other thing is THC levels. Some companies are selling whole bud for smoking. It's illegal to sell whole bud, but if you process it, chop it up and sell it as tea, that's fine.
Why do you think people are drawn or carry on selling flower online?
People are passionate about it. I suppose it's got good marketing potential because it looks like weed. But what they don't understand is 1971 MODA, which is the drug laws here. Any flower of any cannabis plant, irrelevant of the THC levels, is classed as a Class B controlled substance here.
So I do sometimes wonder that some people selling it think, oh, no one else is doing that, I'm going to have a USP, I can sell this, I've got a great idea here.
They're risking their whole business and, they're a criminal record. I mean, it's really not worth it. The Home Office were too late to start enforcing this. It's only in the last 6 months that there's been several enforcements where people have gone to court over this. Really, if you're going to set up a business in this industry, with it being such a complex industry, it's really worth doing your due diligence.
Do you think it's a matter of time before the authorities actually do take action on this? Or is it a matter of time before the laws soften and it won't even be considered an issue anymore?
I just don't think they've got the capacity to enforce it. Earlier this year in January, the World Health Organization made recommendations for cannabis to be reduced from a Schedule 1 drug and also hemp to be removed from any drug scheduling. Now, there's going to be a vote with the UN hopefully in March next year, which I'll be attending. If that goes through, then Moda will no longer exist, and we can sell bud and anything below 0.2% THC, which will really help the market. So that's what I'd really like to see happen. I think it's just outdated laws which are stupid. You can't get high off hemp. Some people are against compliance and just want to sell everything they can, and to a certain degree I agree. I mean, I think we should go for full decriminalisation soon. I mean, it's a medicinal herb that's been used for thousands of years that we're meant to be with. Everybody should have access to it, and it shouldn't be under MHRA guidelines with pharmaceutical companies, because the whole plant has 500 compounds that all work synergistically together. You can't patent it. We need to get away from synthesised cannabinoids, from isolated, and have the whole plant. That's how it's supposed to be with us and every mammal on the planet. I know people in this industry who grow what's illegal cannabis, high THC, for medicinal use, and they give it, not sell it, give it to people who are really ill, terminally ill, and doctors are actually referring their patients to these people who could go to prison for like 15 years. It's messed up, it's ridiculous. It needs to change, but I think there is a perfect storm coming in this industry. Everything's coming together at the right time. We're seeing worldwide changes, and it's only a matter of time. Recreational, medical, call it what you want, it's all cannabis with different cannabinoid profiles. I mean, I don't even think recreational really exists. Most people who take cannabis, whether they eat it or smoke it, normally have it for some reason. If it's reducing their stress, their anxiety, they just want to relax on an evening after work, hanging out with your friends, getting creational. Do you think the Beatles didn't smoke weed?
I was wondering what your thoughts are about the situation with hemp farmers in the UK, the fact they're not allowed to be able to use the bud and flower aspect of the plants.
It's criminal, and as I said, I'm hoping this UN vote in March next year will change that so that it gets removed from any drug scheduling and we can utilise the whole plant. It's such an amazing plant, and it's amusing when you come to something like this, the Hemp and CBD Expo in March early this year. I'm the chairman of Hemptank, which is the UK's think tank for the hemp industry, and I was the only person there representing hemp. Everything else was CBD. And we really need to look at the plant and realise that there's more to hemp than cannabinoids. There's so many different uses: carbon negative homes, bioplastics. You've got about 115 different cannabinoids, and they all work together, and CBD and THC are both important. It depends on why somebody's using it. Obviously MS is normally a 1-to-1 ratio of CBD to THC, so obviously you don't want to just be having a CBD product, where epilepsy, it's mainly CBD with a tiny amount of THC, which is similar to what we're selling in the market already.
You're plugged into the matrix in respect to Cannabis TRades Association. What do you see happening?
The hemp industry growing massively. I see the continuation of the CBD industry. I think doctors will start prescribing medical cannabis, but what I'd really like to see is full decriminalisation, so that we can use the plant in a regulated market, but have the capacity to grow our own, be able to grow it in our gardens, be able to make things from it, and just utilise this plant for everything that it really is. We need to upscale the industry. I'm doing some consultancy work for people who want to grow medical cannabis here, so we can have our own medical cannabis industry, our hemp industry, and cut the price down. Cut the price down to CBD products, and we can manufacture everything here. Once the licensing changes for hemp, we can have a CBD production here. At the moment, we're having to import, which is ridiculous.
People want to get in touch. Where's the best place for them to go?
Go to the CTA website. You can contact me through compliance. If you're interested in hemp or what we're doing with the hemp industry, you can contact me on info@hemptank.co.uk.
Next up, I speak to Mike Harlington, chair of the Cannabis TRades Association. The CTA work with UK government to help build a legal and sustainable UK cannabis industry. They also help members with legal matters and compliance. Unfortunately, when I recorded the interview with Mike, things got a bit noisy around us. We were at the Hemp and CBD Expo at the NEC and sat quite close to one of the seminar stages. So, first up, apologies if the sound quality is not the best. There's always the show notes on the website if you wanted any further clarification. Over to Mike.
The CTA was set up in 2016. Set up in response partially to the MHRA announcement on CBD and sellers selling it with medicinal benefits. Since then, obviously, we reached agreement with the MHRA pretty quickly, so we now sell as a food supplement. Much though the UK would like to think there's a medicinal cannabis market, there isn't really at the moment. But things are changing. We're very much involved with that. Legislation for that going forward. And essentially we represent, we're the largest trade association representing cannabinoid companies in the world now, getting on for 1,000 members and consistently growing. I think we have members from 34 countries now and continuing to grow. Basically, we're the only people in the industry at this point in time that ensure essentially a quality standard is met.
Okay, and I saw your talk earlier. One of the things that keeps coming up is to do with CBD and flower. Can you just give me a quick overview about the status of flower in the UK?
Flower directly contravenes the Misuse of Drugs Act. The Misuse of Drugs Act says that full and total separation of the seed from the stalk has to occur, and there is a separate piece of legislation that says that no organic material can be offered as smokable unless it's a tobacco. So anyone offering a CBD bud is not only breaking the Misuse of Drugs Act and liable to up to 14 years inside, but also they're breaching the 1939 Act. The industry is heading for an implosion. It's heading directly to contradict a lot of the authorities' views. We have the novel foods issue, which is not the easiest of things to deal with, although there is a legal route through. But again, suggesting CBD is novel, which is what the European authorities are doing, is a rather crazy situation. A couple of weeks ago, we actually issued a statement that we will not be joining any of the other trade associations and putting together a novel foods application. I think as part of that, we are going to start seeing a decline in sellers. We are already starting to see a decline in sellers. The number of non-compliant sellers is slowly but surely going down. They are, excuse the pun, being weeded out. The industry itself doesn't like them. In the next 3 years, I would like to make sure, I'd like to think that we'll have properly medicinal products, properly regulated, properly licensed. There are lots and lots of different regulations by lots of different countries, and there is no particular cohesion between any of them.
If people want to get in touch and join the Cannabis TRades Association or find out more about the organisation, where's the best place for them to head?
Cannabistrades.org, trades with an S. Basically, the vast majority of information is up there.
In this next section, I speak to David from Adact Medical about testing. CBD is classed as a novel food in the UK, and as such, any product going to market, whether it's oil, a balm or gummy bears, needs to be tested to ensure regulatory standards are met. David talks about product testing, compliance, and the future of CBD.
We're a testing laboratory based in the UK, and what we do is we test products for A, the end user, B, manufacturers, C, farming, every product you can think of. So we'll do isolates, distillates, gummies, drinks, balms, you name it, we will test it. And we do a full spectrum test on the CBD, which means we test for 14 cannabinoids, which should be in the products, heavy metals, pesticides. So we basically test everything that needs to be shown for a product to be allowed to be sold in the UK. How we do it is we receive samples, we blind test, we do 3 tests on the same products. What we're testing for is to make sure there's no THC above 0.2%, which is the legal limit within the UK. We've got a lot of people that import and buy in from other places, and we're making sure everything that they're supposedly buying is correct. Simple basics, C of A, C of C, batch documentation. So all about traceability. If you're a manufacturer, they should be supplying a certificate of analysis for everything that they do. What we're finding is that on certain samples that there's a C of A, which is certificate of analysis, but it doesn't match the batch sample that we're testing. Certificate of analysis has got to be from start to finish point on that product. Certificate of conformity means that what they're actually supplying you is what they say it is on the packet. And that's what we want to make sure that everybody's following this. So,
Yeah, because I was thinking if people were doing something like, let's say, white labelling, they wouldn't normally be doing this testing, would they be relying on the manufacturer in
Yes.
the UK to be covering this? But if
Yes.
they're bringing stuff in from overseas, then they need to be responsible.
Exactly what you're saying there, because when they're saying white labelling, they're not understanding that they should be provided with this information, and they're not getting the correct information from the people that are giving it. So it's got to have paperwork from start to finish, as simple as that. So we make sure at the end of the day what they've got in that bottle is what it says on the label, and the customer is getting what it should be.
What will happen next 5 years? What will happen next 5 years?
In terms of the next few years in the UK, where do you see regulation going?
I'm going to give it 18 months, and I see the regulation they'll be looking at to make it into a medicine. And that means that they're going to separate and standardise it. That's my opinion, because I've been in herbal remedies, traditional herbal remedies and pharmaceuticals, and what they'll do is, because they know it works, they're going to try and isolate it. So I do think it's going to become a medicine at some point.
If it became a medicine, where would this leave your smaller brands?
It won't. I think the smaller brands will go. And this is what happens with everything. You're going to have DMFs, GAP. So it's going to be good agricultural practice from the field. Then they're going to have drug master files created, which cost a lot of money. The pharmaceutical companies don't like the natural products biting into their product. And we know it works, and it's just a matter of time. It's going to happen. They're going to do it. You're going to have the usual products that are going to be VMS, which is like, vitamins, mineral supplements. You're going to be able to sell them, carry on selling, but they're going to be of such a low dosage. But the ones that, really work, it's going to come under the Medicines Act, definitely.
If at the moment, for example, you were selling CBD gummies or CBD chocolate,
Yeah.
if it was reclassified as a medicine, you wouldn't be able to manufacture and sell those products. Is that what you're saying?
On a medicine, it's going to be a parameter, so you're going to have a standardised extract against
In
it.
terms of the testing, if I've got a product,
Yeah.
what are the sort of costs involved in doing a product test?
We generally charge £150 for a product that an individual might send in. Depending on the size and how many we do, it will be reduced. So we're talking £90, but we do heavy metals, everything. So it's £90, and we do the full spectrum test.
Where's the best place to find out more information about your company?
adactmedical.com. Send us an email, and we'll gladly pick up the phone and have a chat.
So that's Adact, which is ADACTmedical.com. Thanks for
Thank you.
that.
Thanks for your time.
Hey, I hope you enjoyed the show. Maybe you got some useful ideas or heard something that inspired you in some way. You can access the show notes for this episode on the canamachine.co.uk website. If you're enjoying this podcast, feel free to subscribe, rate or leave a review. If you'd like to get in touch, then you can reach me at info@canamachine.co.uk. And until next time, stay lucky.
Yeah.